Help Me Get Pregnant Naturally is a series of information. Each series will have a plan on how to increase your chances of getting pregnant naturally. I'm going to provide you with advice and tips on how my girlfriend and I had our first newborn baby at the age of 45. Not only did my girlfriend get pregnant and defy all odds, but we also produced a perfectly healthy baby girl. She scored a 9 out of 10 because the hospital does not give out a 10 out of 10. I will give you all the information we used to enter this whole new world of parenthood. Hi, I'm Danny Moser, and welcome to Dad's Den. A little history about females and their eggs. At birth, a girl is born with all her eggs that she'll ever have. This number is approximately 1 to 2 million eggs.
Wow, that's a lot of eggs.
By the time she reaches puberty, this number will decrease to 400,000 to 300,000 eggs. Still seems like a lot of eggs to me, but a big decrease. Reason for this decrease is 10,000 eggs die per month. After puberty, a female will lose 1,000 eggs per month, which equates to 30 to 35 eggs lost per day. Scientists aren't sure why this happens, but they know that it isn't influenced by most things we can control. It's not influenced by your hormones, birth control pills, pregnancies, nutritional supplements, health, or even your intake of chocolate. The only exception is specific chemotherapies, radiation, and smoking will accelerate egg loss.
Eggs fact. Age 30 years old, she will have 100 to 150,000 eggs in reserve. Age 35 years old, she will have 80,000 eggs in reserve. Age 37 years old, she will have 25,000 eggs in reserve, or 2.5% of your starting count. Age 40 years old, she will have 5,000 to 10,000 eggs in reserve.
Women are most fertile before the age of 30 to 32 years old and gradually decline in fertilization as they get older.
Women's age +% conceiving within 12 months. 20 to 24-year-olds have 86 to 92% within 12 months. 25 to 29-year-olds have 78% chance within 12 months. 30 to 34-year-olds have 63% chance within 12 months, while 35 to 39-year-olds have 52% chance within 12 months. Odds of conceiving each month. Under 35 years old have a 25 to 30% chance per month. 35 to 39 years old have an 8 to 15% chance per month. 40 to 42 years old have a 5% chance per month. 43 years old have a 1 to 4% chance per month. 45 years old have a 1 to 3% chance per month, while 50-year-olds have a 1% chance per month. Age affects not only fertility rates but also miscarriage rates. 20-year-olds have 10% chance of miscarriage. 35-year-olds have 15% chance of miscarriage, while 45-year-olds have 50% chance for miscarriage.
That abnormalities and defects increase after the age of 35 years old. Reason for this is the quality of the eggs tend to decline. These risks include C-section, premature birth, low birth weight, birth defects, and stillbirth. Medical conditions like diabetes and high blood pressure are common, which then can lead to pregnancy complications like preeclampsia and gestational diabetes. No matter how old you are, if you still have your eggs and your menstrual cycle, you will have the opportunity to get pregnant. By the end of this series, you will have all the knowledge and opportunity to increase your chances of getting pregnant. The best time to conceive is during a woman's fertile window. Ovulation occurs when the ovaries release an egg, which travels down the fallopian tube and survives for 12 to 24 hours. You can get pregnant if the egg gets fertilized with sperm. The chances are highest within 24 hours of ovulation and 1 day beforehand. But because sperm can live for 3 to 5 days in the reproductive tract, it's also possible to get pregnant by having sex in the 5 days leading up to ovulation. In other words, 5-day-old sperm can still fertilize a newly released egg. Ovulation calculator works best if you have a typical 28-day cycle. You can use an app or a journal to help you track your menstruation for a few months. Then look at the date to determine your average cycle length. Keep in mind that a woman is most likely to conceive on the day of ovulation and 5 days before it. The first day of the menstrual period is considered day 1 of the cycle, and ovulation usually happens about 14 days before the next period is due. Example 1. If the interval between periods is 28 days, you would predict ovulation occurs on day 14. The fertile window is day 9 to day 14. Example 2. If the interval between periods is 30 days, you would predict ovulation occurs on day 16. The fertile window is day 11 to day 16. Example 3. If the interval between periods is 35 days, we would predict ovulation occurs on day 21. The fertile window is day 16 to day 21. A basal thermometer is one way to track your most fertile days. Sleeping, waking up in the morning, check temperature. Every morning you will check your base body temperature before getting out of bed. You will enter the temperature in your app or journal. The temperature rise may be as little as half of a degree. This can be a signal that you have ovulated. Keep in mind that an egg only survives about 24 hours after ovulation, so this so-called fertile window may not be a good indicator of when you should have sex, as this method only detects ovulation after it has already occurred. I would only recommend this to help confirm ovulation or gain a sense of one's average ovulation date. These sensitive thermometers are an inexpensive, easy to use, and a form of natural family planning. They're not always the best ovulation predictor if you have irregular periods. Other concerns that this method isn't always reliable include different factors, such as infection that can cause a rise in temperature. Some women also find it difficult to detect that rise. This method is still worth trying and can help increase your chances of getting pregnant. As the ovarian follicle, a small sac in the ovary that contains the maturing egg develops, your estrogen level rises. This rise in estrogen causes your cervical mucus to increase in volume, be clear, become thin, and slippery compared to other times of the cycle. If you notice your mucus looking slimy and thick, almost like egg whites, there's a good chance you're ovulating. Some women may also feel a one-sided twinge of pain. As you start seeing these changes, you should begin having sex every day or every other day until ovulation. This will increase your chance of getting pregnant. Available at most drugstores, you can use an ovulation predictor kit from the drugstore, which tells you exactly when you're ovulating by detecting a surge in your luteinizing hormone, LH, in the urine, which occurs 36 to 48 hours before you ovulate. These kits are like a urine pregnancy test. You will urinate on the test strips every morning, starting a few days before you think you will ovulate. These are good screening tools to reassure you that you are all ovulating every month. Once you get a positive result, check your test instructions for details. You should have sex that day or for the next few days, thus increasing your chances of getting pregnant. A fertility monitor is a handheld device with disposable test sticks. The monitor identifies changes in your urine levels. The test detects a rise in luteinizing hormone known as LH in the urine. When a rise happens in this hormone, it will cause the ovary to release an egg. This is a home test kit which is designed to identify all your high and peak fertility days. The test kit can be expensive but also effective. This home monitor will help you determine the best time to have sex and get pregnant. If you're having difficulty tracking your ovulation using the above methods, you can talk to your doctor about your options. Ovulation can best be understood through follicular monitoring, which should not be painful. A small ultrasound probe will be inserted into the vagina, providing an accurate image. It is an ultrasound scan done inside the vagina to study the ovaries, uterus, and the uterus lining. The follicular monitor uses a sterile transducer, paying particular attention to the follicles within the ovaries. It is conducted at regular intervals and documents the pathway to ovulation. The growth of the follicle will be documented by photographs and plotted on a chart. After a follicular scan, a couple can try for pregnancy when ovulation is likely to happen. By seeing a good doctor, you will be able to rule out any major factors affecting fertility. For example, polycystic ovary syndrome, which is one of the leading causes of infertility. Left undiagnosed and unmanaged, it can impact fertility. Other infertility risk factors are chronic disease such as diabetes, lupus, arthritis, hypertension, and asthma. Checking for sexually transmitted diseases, which often show no symptoms, is recommended. In the preconception period, I also recommend all women have their rubella immunity checked. Catching rubella during pregnancy can harm the fetus. Some of these conditions may be more general, for example, thyroid disease and vitamin D deficiency. For those with fertility issues, doctors can sample blood to see progesterone levels, which can confirm ovulation. I want you to get pregnant and have that perfect, healthy baby at birth. Don't give up, as I will provide you with all the tips and tricks my girlfriend and I used to get our precious baby girl. No matter how old you are, if you still have your eggs and your menstrual cycle, you will have the opportunity to get pregnant. By the end of this series, you will have all the knowledge and opportunity to increase your chances of getting pregnant naturally. Subscribe, like, share, so that others who are facing this difficulty of pregnancy situation may also share in the power of knowledge.